This is Alginate impressions, and so we're gonna go through the whole process of taking an Alginate impression. Okay, Alginate impressions are, we use Alginate impressions to take diagnostic casts. Also, Alginate impressions can be used for making some bleaching trays. We can use Alginate impressions sometimes to do RPDs, and there's many other things that we can use a good Alginate impression. So in order to take a good Alginate impression, we're going to go through the basics of this. The first thing we need to do is examine the patient and see what kind of tray we're going to use, and if there's anything that we need to take care of before taking an Alginate impression. And this is, so we go to the patient's mouth, and what we're going to look for is open up your mouth, please, and we're just going to do a truly examination, a slight examination, and what I'm trying to find is any temporary crowns, any removable partial dentures, or any other prosthetic component that might either come off with the impression or locked in the impression as I'm taking it. Sometimes when we have bridges, Alginate will flow under the pontic side, and we may get locked that impression. Also, some patients would have lingual torites or maxillary torites, bony protrusions that will prevent from sitting that tray all the way down, or can lock down that tray. Okay? So once we check, open up for me, sir. Thank you. Once we truly check for any of those problems, the only thing I need is a disposable mirror or just a mirror. I also want to see an easy way to check or to measure or give me an idea of what size of a tray I'm using. I will use the back end of the mirror, go take it to maybe to the first molar area, and from there I can basically get a measure, a very rough measure. Then I can go on my trays and kind of like place it where it might go to the first molars. In this case, for example, I probably will be going for a large plastic trays. When we talk about plastic trays, we have, like the ones we're using here, plastic trays, or we have metal trays as well. We decided to use large plastic trays in this case, and I'm just going to try it. I want to try it in. I'm going to try in the lower one first. What I like to do is I like to retract with the mirror on one side, and then as I'm retracting on that side with the same tray, I'm going to retract the other side, have it there, and make sure this tray fits comfortably. It waggles a little bit, and most important, that covers most of the teeth. Okay? If for any reason the tray does not cover all the teeth, we can always add wax around the edges of the tray, just to make it a little bit bigger. Or also the tray, the wax on the tray will help it make it fit better. Some portions we need to make it fit better. You know, it'll get a little bit bigger and can copy better the deepest part of the vestibule. Okay, you don't have to use it all the time, but if you see that you got the right or the correct tray size, and you have, let's say, third molars, maybe you want to add a little bit of wax like that. This wax is very soft and it can be very moldable. Now I take it back to the patient's mouth. Again, I retract on one side, I set it right there, and I need to make sure, let's see if we can get a good shot. that the tray covers entirely all the teeth. Okay, this is what I'm looking for. So this tray is it's a good one for that. I want to try the upper one now. On the upper, again I retract. I want to go all the way to the back to where the hamular notches are. Okay, and then from there, make sure it covers all the teeth. This one is a very good size for our patient. Okay, make sure it wobbles and it's easy to take. Now that we have chosen the impression trays we need, it's best to do it this way so you don't cross-contaminate and you get to try small, medium, large. Using the back of the mirror, you can get a ballpark idea. Okay, so let's go for the next step. Next step, now that we check patient's mouth, now that we decide which tray we're using, it's time for, when we're using plastic trays, we need to put some adhesive on it. The adhesive, it's a special adhesive for plastic trays and alginate. If you're using any other impression material, you need to use a compatible adhesive, okay? The adhesive comes with a special brush, but this brush, I'm not gonna put, because this tray has been already in the patient's mouth, so if I use this one, it would be like if you're double dipping nachos in the Super Bowl, right? So what I'm gonna do is I'm gonna take some of the adhesive, put it in an amazing cup, use another disposable brush, and just paint a thin coat of adhesive all around the inside of this tray. It's very important we get a thin coat everywhere, and also include the sides. Remember, the alginate is going to start flowing all around the tray, okay? And we need a good retention of the acrylic. Once we do that, then you shake it. And you shake it to dry it out as if it was a
Polaroid picture.
Polaroid picture, right? We do this with the upper, and we do this with the lower. In this case, I'm showing the use of the wax. We didn't really need it, but I just wanted to show you how it can be used. Okay? Once I have a thin coat of both adhesive, we shake it, and we get it done. Okay? Now, when it comes to alginate, it's a irreversible hydrocolloid. Irreversible hydrocolloids are one-time use, okay? And some very important facts about the alginate is the measurement of the water is the water ratio mix. It's very important to get the right consistency. When you're using alginate measure like this one is 3 scoops of alginate, and you will get a measuring cup that has also 1, 2, 3 scoops of water. What I want to do, because of we've been taking impressions for so long, we want to have the water just below of where it says powder. That means it's almost 2 3/4 or 2 2/3 of water. We're not going all the way up, because the amount of water we'll get, the more water we put on the mixture, the more runny we'll get this mixture. And because we're taking impressions of patient's mouth, we don't want that alginate running or being very flowable and probably going to the throat of the patient or something like that. So we're gonna make it a thick mixture of it. When you're opening this, it's very important. As we open the pouch, we don't want powder coming out. You see the powder? This powder I just did on purpose right now, but these particles can be inhaled, and this stays in the patient's or in your lungs, and they're not safe to do. It's not safe to do that. So we open it up, pour it in there. Please use masks as you're doing this process. I'm not using the mask right now because of, I need to talk. Then we use the dark bowl, okay, which is stiffer, and this bowl is specifically made for alginate. And we got two different kinds. Well, actually, we got three different kinds of spatulas. The wider spatulas are made for alginate. The thinner ones we have are made for stone. In this case, what I'm going to do, can you see it very well there, Marco? Yes? I want to say thank you to Marco, my camera guy, this time. And what I'm doing is, I incorporate the water onto the powder, and at the beginning, I like to incorporate it and start mixing. Once I get a thick mixture, then I go to the walls of the bowl, trying to make a more consistent mixture of alginate. Okay, as I do this, I'm getting a more homogeneous consistency, and if you see, it's not runny. Okay, this is the consistency I'm looking for right now. Okay, on this patient, I'm gonna load the upper tray. As I load the upper tray, make sure I get all these, and then I do a little bit of extra in my hand. And what I'm going to do is I'm going to take this extra and I'm going to go on the occlusal surfaces of my patient's mouth. Okay? Then I will retract from one side, I will put this on the other side, and then I will go all the way to the back. You see how I'm going to the back? I'm setting this part all the way to the back. And then I roll towards the front. As I'm rolling towards the front, all the excess is rolling with it. As I'm doing this, I'm pulling the lips, making or overlapping the tray all the way up. Okay? And here I wait. I got good support of the tray, and I also got good support of my patient. If my patient at this point starts gagging, I got good control for him to either push the face up like this or distract him. If by any chance the patient starts gagging, I will ask him to lift up the right hand, right foot for 5 seconds, and then switch to the other one. This is not going to prevent him from gagging, but he's going to take his mind off the gagging reflex. Okay? I can ask him to raise the hand. I just need to distract him and take the mind of the fact that he's gagging. Okay? When do I know the alginate is ready? I always keep a little bit outside, but also inside of the mouth. When this gets a hard consistency, it will be ready to be taken out. How do I take it out? It's very important that we use a snap motion. That means I'm not going to be wiggling it around. I'm just going to go for one instance from the back. It's not coming out. From the back and then out. You see, I broke the seal and then I took it out. And what am I looking for? Do you get a good shot right there? Mm-hmm. Okay. What I'm looking for on a good impression is that I get material all the way up to the deepest portion of the vestibule. I copy all the teeth free of bubbles. I copy all the palate, okay, and I get not so much excess in the back. this is what I call a pretty good impression. Okay? So what do I do with the impression after this? Something very important. I need to go ahead and disinfect the impression, rinse it out, and right now the irreversible hydrocolloid is going to start going through some phases, such as how do you say, Marco? Syneresis and imbibition. Okay, that means it'll start absorbing or expelling water. So what I need to do is I need to give a 100% humidity environment for the next, half an hour maybe, while give me the time to take the second tray, the second impression. I will leave this one on a sealed bag like this. Now my impression is being it's in a safe spot, right? If you leave it outside without any water, it'll start expelling some water. If you leave it deep in water, it'll start absorbing water. As it absorbs or expels water, the alginate will start distorting or getting distortioning, right? How do you say that, Marco?
It'll start becoming distorted.
Okay. So normally you will have your assistant here cleaning up your mess. In this case, my assistant is I have one assistant in the chair and the other assistant is taking video, right?
See.
So we might be editing this part there. But anyways, as we clean, there you go. There we go. And we repeat the same process for the lower. I'm going to show you a couple of tricks that we're going to do on the lower. But now let's take the lower impression. Again, we got the alginate. Alginate, some people will open it as if it was a bag of chips or in a hamburger way. I like to open it in the hot dog way. You see, I learned that last year with the D2 students. So hot dog way, very nice way to do it. You see, patients get so messy, it's perfectly fine. I don't mind for them to get messy right now. What I need is to get a very good impression. After that, they'll clean up and nothing's gonna happen. I do it again, I incorporate the water into the powder, right? I start incorporating this into a thicker mixture. Once I get this mixture pretty even and homogeneous, then I go onto the sides. And this movement here that I'm doing towards the sides or the walls of the bowl will give me that nice creamy consistency. Okay, working time, you will start, the more you make, the more impressions you take, the better. You see the creamy pasture or texture. The more impressions you take, the better you will get at timing or getting that working time of the materials. Okay, remember, the temperature of the water will directly affect. Again, I take a little bit of alginate, rub it on the occlusals. I can use the mirror or I can use my finger. Okay, I do this, I set it. Once I set it, I go from the back. Once I set the back, I roll it towards the front. I ask my patient to lift up the tongue. Good job. I make sure I stretch out those cheeks here, okay, and I hold it. Now, I know I have a little bit here that will tell me how is it getting ready or not. But inside of the mouth, because of the temperature inside of the mouth, it'll run or it'll set faster than outside. I always need to be very, very careful on keeping it this stable. Many people just take the impression and they take off. You cannot take off. You have to be very careful of the excess going to the back of the mouth. You have to be, looking at your patient's reactions, and you have to be very careful on taking these impressions, or you don't take it. You have to take it very serious. I take the excess off. Open up for me. Once it's set, it's pretty much set. Again, I come from the back, I snap it in the outside from the back, and then I take it from the front. And what do I get? I got one little bubble here that it's not in the way of what I'm looking for, but look how I get the whole vestibule very well, the whole lingual vestibule as well, and all the teeth perfectly centered in the middle of the tray. For the lower trays, let me clean this up. Maybe we'll edit this portion here. Let me take these gloves off. There you go. Let me take this other one. For the lower impression, we need to fabricate the tongue space. We need to fill up this tongue space. There's so many ways to do this. A very easy way to do this, I'll show you. You will grab a paper towel. This paper towel, you wet it, and then you fold it until you can pretty much put it right here. Can you see there, Marco?
Lift it up.
So this will just fit in this space, okay? It doesn't have to fit snuggy, or how do you say that? Snug. This is just gonna be a support for some alginate. So let's leave it here in the table like this. I'm going to take a little bit of alginate, some alginate, maybe about a scoop or two, maybe just about a scoop. And this one's not going to the patient's mouth, so I can kind of like eyeball it. But I follow the same principle. I incorporate the water into the powder, and I go towards the walls. In this case, I'm getting a much more thicker. I didn't put as much water, and I'm getting a much more thicker consistency of alginate. You'll see. It's almost as thick as you can play with it. You see? And this, we'll just set it up here, and with some water, I'm just going to adapt this into the floor of the mouth, making the tongue space, filling up the tongue space with some alginate. That way, when I pour up the impressions will come out very, very smooth. This is how a lower impression should look like. Tongue space completely filled with some alginate. Okay? All teeth are enclosed or within the tray, and the deepest part of the vestibule is very well copied. Now, what do? Well, this one also has to be disinfected. Then I rinse it. I get 2 paper towels. I wrap it up, and it goes into the blue. Once we got the two impressions, this is what I want to get out of the impressions. Like I said, all the teeth are enclosed or within the limits of the trays. I have copied the deepest portion of the vestibule. On the tongue space of the lower, I filled it up with some extra alginate, and these trays or these alginate impressions are ready to be poured. We'll go upstairs and pour them up in the lab. Salud.